The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
If you've ever had a painful hand, or a bursitis, or a carpal tunnel syndrome, you will get a greater appreciation for the skeletal system with all that comprehends. In this next program, we'll be studying about some things having to do with the skeleton and how to work on the skeleton so that it can be better functioning. So join us for this program.
Welcome to Help Yourself to Health with Dr. Agatha Thrash of Uchee Pines Institute. And now, here's your host, Dr. Thrash.
The skeletal system consists of bones and joints, joint fluids, tendons, fascia, and it's associated very closely with things like arteries and nerves and veins and soft tissue. And in this way, we find that the skeletal system involves just about all that there is of a human being. You can have your day to be totally ruined just by having an ache in your foot, or a little headache that annoys the person. So with such things as the carpal tunnel syndrome. Now, carpal tunnel syndrome is an affliction that involves the pain of the hand and arm, and many people who have this feel that the worst affliction that one can have, so far as the skeleton is concerned, is that of the carpal tunnel syndrome. And we'd like to talk with you about the carpal tunnel syndrome, and Cheryl Shears is going to tell you about some things having to do with how to evaluate yourself for this disorder.
Carpal tunnel is an area in the hand, about the wrist area, and it is made up of some dense fibrous tissues that extend up over the wrist and into the palm of the hand. Through this tunnel passes many tendons, arteries, and the median nerve. The symptoms are caused from compression of this nerve. This syndrome is most often seen in women rather than men, and it is usually in people within the age 40 to 70 years of age. The cause of carpal tunnel syndrome has not been specifically identified as yet, but there are certain associations that have been recognized. I will mention 4 common associations. Pregnancy is one of the common associations, and it is thought that it is because of increased fluid retention. Women who are taking oral contraceptives may have the syndrome, but within 3 months of termination of pregnancy and the taking of oral contraceptives, many of these cases will clear by themselves. It is also seen in people with diabetes. And then there is an occupational association. People who work with their hands in certain repetition motions, such as knitting, or keyboard operators on a computer have this disease. How do you know if you have carpal tunnel syndrome? There are 2 simple tests that you can do at home. And one of them is simply this. Take your finger and just tap at the wrist like this. A simple light tapping will cause pain with those who have carpal tunnel syndrome. Also, you can take the wrist and tip it down in a position like this, holding this for 60 seconds. This will cause pain in those who have carpal tunnel syndrome. You may also notice a slight swelling in the wrist due to fluid retention, or there may be some atrophy or shrinkage of this fleshy muscle here on the palm beneath the thumb.
Very good. With these simple tests, you should be able to make a diagnosis with ease of whether you have carpal tunnel syndrome, and we hope you can. Unfortunately, the diagnosis is often difficult even for professionals to make, so you're at best probably only likely to get a hint as to whether this may be the problem that you're dealing with. And Danny Blackburn is going to tell you some symptoms that will also help you to understand more about this kind of disease and just what you may be able to do in evaluating yourself. So Danique, tell us about symptoms and then tell us some things about treatment.
In carpal tunnel syndrome, usually the symptoms are quite specific. The person who suffers from this syndrome usually has tingling and numbness in the hand from the wrist even all the way down to the fingers. It often involves the first 3 fingers and often part of the 4th, and also the person may have weakness in the muscles of the hands and inability to operate the thumb well. Now, treatment for carpal tunnel syndrome, one of the most important things to remember in the treatment is to start early. Begin to start treatment as soon as you get the first symptoms of this syndrome. One treatment is to promptly cease all excess use of the wrist and the hand in such occupations as gardening, sewing, excess crocheting and knitting, and things that will cause excess use of the wrist and the hand. Also, you want to, at nighttime, immobilize the wrist by using a splint and an ACE bandage to apply the splint to the back of the wrist and the forearm and wrap ACE bandage around to immobilize the wrist during the nighttime. Also, as Cheryl mentioned, many times carpal tunnel syndrome is associated with excess fluid retention, and you will want to, in the treatment, remember that you can use diuretic teas such as burdock root and corn silk and watermelon seed. Also, drinking of water is also a very good diuretic, so you might want to remember to drink your water every day. There's also some evidence that carpal tunnel syndrome is caused by a deficiency of vitamin B6 in the diet, and we can find this vitamin B6 by eating foods high in it, such as whole grain cereals, legumes, bananas, and oatmeals. Also, for the treatment of carpal tunnel, we will also want to get rid of all drugs that are suspected of causing this, such as oral contraceptives and female and male hormones. And by following these simple remedies, you can be sure to find relief from this syndrome.
Very good. And we are certainly hopeful that you will be able to treat yourself for the carpal tunnel syndrome armed with this information. Now, I'd like to talk with you about arthritis. Arthritis is a very common problem in the United States and around the world, and has many different kinds, probably more than 100 different kinds of arthritis the world over, maybe even more than that. But the kinds that we will talk about are only rheumatoid and gout. I'd like to show you first a normal joint, and I have a graphic that will show this to you very nicely. The normal joint is comprised both of bones as well as soft tissue. And here you can see that the bones are separated from each other by a space. This is called the joint space, and in it is a fluid called synovial fluid. Therefore, the joint is joint space is sometimes called the synovial cavity, as it is here on this diagram. The periosteum is a membrane around the bones. It attaches itself right against the bone with a great deal of tenacious adherence and is very painful. A large part of the pain felt with bones, such as fractured bones, comes from irritation of the periosteum or damage to it. Now, notice the synovial membrane here, which is the lining of the synovium. It is as if the synovial space is something like a balloon, and the two bones are pressed into this balloon, and the synovial membrane secretes a fluid. This fluid is not oily, as many people feel, but is watery, Consequently, the use of a lot of oils is not necessary in order to keep the joints lubricated, but rather the drinking of a lot of fluid, such as water. And we do find that people who have almost any kind of skeletal problem, if they drink a lot of water, this skeletal problem will feel a lot better, even things like cricks in the neck or backaches and the like. And so in this way, you can see the kind of thing that we're dealing with a normal bone. Now, something can happen to the bones that can make them deformed in some way. Rheumatoid arthritis is one of those things. Rheumatoid arthritis is one of the most crippling of the arthritis forms, and I'd like to show you one of the results of this disease by showing you a hand. So here in this diagram, you can see how the hand is twisted with rheumatoid arthritis. The joints are actually destroyed, and the bones then take on a different position. Now, with rheumatoid arthritis, there are things that we can do that will help the person who has rheumatoid arthritis to feel much better. We had a patient at UT Pines who was in her early 40s when she began to feel generalized joint pain. Most of her joints eventually became involved, although at first she had joint pain only in her elbows and shoulders and knees. But eventually, most of her bones became painful, most of her freely movable bones. When she was first examined by a physician, she had a lot of inflammation around her joints, swelling and tenderness, and sometimes redness and discoloration. And with her disease, she became completely disabled, so that she was not able to move well at all. She could not do her housework, she could not cook, and the disease was most uncomfortable for her as well. She often felt bad generally, with a little bit of fever and a little bit of headache, and all over she felt discomfort. Her appetite was not very good, and she lost an interest in life and became a little bit depressed. It was difficult for her to lie down in bed. It was difficult for her to get up. And so with the disability that she had, she was very discouraged. It was in this condition that she came to UT Pines. I wish I could tell you that we knew a remedy that gave her total relief and total healing, but that was not the case. We were able to help her, however, so that her joint pains became far less. She still walks with obvious broad base, and her fingers are not entirely mobile as they once were, but she is a great deal better. She now feels good most of the time. She's gained some weight, her appetite has returned, and the way that we treated her was very simply. We used first an elimination and challenge diet. What we did was to remove certain foods from her diet for a period of time and then reintroduce them to see if she felt better not using those foods or better using those foods. There were certain foods like rice that we found that when she ate that, she didn't feel as good as otherwise. We gave her a nightshade-free diet. That's without tomatoes, potatoes, eggplant, and peppers. But for her, she got no relief from leaving those off, even though she left them off for as much as 6 months at a time. But several other foods were involved with that. But we think that one of the most important things we did for her was a totally vegetarian diet. And there are some very good reports showing that a totally vegetarian diet does act as a great helper in arthritis. There is also a very simple extract made from red pepper and alcohol, such as we have here, a heaping teaspoonful of red pepper and a cup of alcohol, let it soak for 3 weeks, and then carefully save the alcohol, and the pepper can be discarded. This substance, this extract, can be rubbed on the skin over the painful joint, and that often gives a lot of help. Here is a report that came from Stockholm giving the effects of this red pepper extract. The active ingredient is a substance called capsaicin, which uses up P substance in the skin, and P substance is a part of the pain transmission pathway, and if the P substance is used up, then of course the person doesn't feel the pain anymore. Let me just read a bit of the abstract of the article that was published concerning the use of capsaicin and its effects in arthritis. It says that the substance P concentration in rats was reduced by 42% as they applied the capsaicin. This was accompanied by a 40% reduction in inflammatory response as assessed by comparing the ankle joint weights of the experimental groups. And so we can see that pain and inflammation were benefited by the use of the capsaicin rubbed, or the red pepper extract rubbed on the joints. Now, it has been felt for a number of years that probably something about the intestinal tract was involved with people who have rheumatoid arthritis. And this may be true. Some research is certainly pointing in that direction and helping us to believe that this may be true. Here is a report that came out in 1994 from Scandinavia showing that abnormal colon microflora, or the germs that ordinarily live in the large bowel, that these are altered in people who have rheumatoid arthritis. And so as the bacteria that grow in the colon are studied, it is found that these bacteria are not exactly like those that grow in the colons of other people. And furthermore, they don't do exactly the same thing. They found that the degradation of cholesterol to one of its degradation products was altered in people who have rheumatoid arthritis. Another one was very interesting to us in that this research showed that certain types of the microflora or bacteria in the colon were reduced in people who were on a vegan diet. A vegan diet is one that emphasizes fruits and vegetables and whole grains and uses a few nuts and seeds. It uses no animal products like meat, milk, eggs, or cheese. We tried this kind of diet for the patient that I described. And in the study that was reported, showed that Proteus, a bacterium that grows in the colon, was reduced in people who were on a vegan diet for a year. So we feel that it's very important and very helpful for people to use a vegan diet. We felt that the vegan diet greatly helped the woman who came to UC Pines with the arthritis. Now, a study from Finland showed a similar thing on the intestinal flora and the activity of rheumatoid arthritis. I'd like to read just a bit about the study that they did, which was reported in 1994 in the British Society for Rheumatology. Significant alteration in the intestinal flora was observed when the patients changed from omnivorous to vegan diet. There was also a significant difference between the periods with vegan and lacto-vegetarian diets, the vegan diet being more effective. The fecal flora from patients differed significantly during the diet, and that was for a 1-year period. Now, another thing that we did for the patient that I described was to keep up her exercise. When she first came, she had the mistaken idea that it would be better for her not to move. And when she did move, she found that she did hurt, but we also found that she didn't really hurt any more when she exercised than when she did not exercise. So here is a study on patients with rheumatoid arthritis with different kinds of exercise programs. And what they found was that a dynamic and rather intensive group exercising for people with rheumatoid arthritis was very helpful. They did the exercising 3 times a week, and we believe that it would be better if it were done maybe 4 times a week or as frequently as the arthritis person can tolerate it. And we found that joint mobility was better, so did the researchers here, that muscle strength was better, and that general physical conditioning was also better. And one of the great pluses that we found in exercise was that the person felt brighter in their spirits after getting the exercise. Now, a study that was done in Finland showed that a group of people with psoriatic arthritis were also helped. Notice this, the present results suggest that dynamic strength training in early arthritis increases the neuromuscular performance without detrimental effects on the disease activity or giving any joint damage. And so we're happy that these very simple things, which also give multiple benefits to the body, that these can be found useful for the person with rheumatoid arthritis. We gave our patient massage at first on a daily basis and hydrotherapy, a hot bath or a soak in a hot tub at her own convenience. We did not give her a treatment fever bath. We just let her soak in a tub of hot water as long as she wished, and she was improved by both of those, both the hydrotherapy as well as the massage. Here is a study published in the British Society for Rheumatology. This one comes from the United States, and it showed that a clinical trial with black currant seed oil was helpful to people with rheumatoid arthritis. Now, what the researchers did was to give people with rheumatoid arthritis 1 tablespoonful per day of the black currant seed oil, and they maintained this dosage for 24 weeks. They felt that it helped not only the symptoms of the disease that the person felt, but that it also helped the signs that the patient would feel. Now, you can see with these things for arthritis that in the home we have the capability of doing a lot of things for people who have rather serious problems. Now, with the appreciation that we can get for the skeleton from studying people who have joint disease and bone disease, we can understand that some things having to do with just such a useful and ordinarily pain-free and trouble-free organ as the hand, that this can cause the person to have a great deal of disability. As an example, a trigger finger. Now, a trigger finger is that a finger is bent, and then when it is straightened out, it can't be straightened out easily. It jumps into place. So you hold it down, and then it jumps back when you try to open up the hand. And it can cause quite a great deal of pain for the person, pain in the hand. And there are several things that can be done. One is a bowl of ice water. So take a bowl such as this that the hand will fit into and put ice in it, and then plunge the hand into the ice water and let it stay for 20 minutes. That's right. So set a timer for 20 minutes, and so you just set it there and let it tick away. And then the one good reason to give a timer is that the person looks at it, and when the time gets close to the end, they are really very happy. So when it makes its ding, they're very happy that the time is over. And so both of those things can be very helpful. The use of the capsaicin on the hand is helpful, and so is a solution of DMSO. DMSO with comfrey, 1 cup of DMSO, which you can get from a health food store or a pharmacy or a feed store or a place, some industrial place. You can get the DMSO, put it in a jar like this with 2 tablespoons of comfrey leaf, 2 tablespoons of wild lettuce, and 2 tablespoons of white willow bark. Just put this together and let it set for 3 weeks. Then this can also be used to paint the hand in this way. Then the use of castor oil can be also done very nicely. Castor oil, we see here, can be obtained from any pharmacy or any kind of department store, and it is a very simple thing. And I've asked Danique Blackburn to help me with the demonstration of this. The only thing that you have to do is take a piece of cotton and get some of the castor oil on the cotton, then rub it on the hand and on the finger that's involved with the trigger finger, back side and front side like this, then leave the little piece of cotton there. Take a bag such as this and let the person put it on. And in this way, one can just put it on, cut a place for the thumb and the fingers, and then it is worn overnight. And just a rubber band loosely placed around the wrist, then the fingers fit over it like this, and usually a person can spend the night with this kind of rig on without a great deal of problem. The plastic, of course, keeps the oil off the bed. It should be done every night. It is believed and has been demonstrated that castor oil used in this way increases the number of T cells that a person gets around the area where the castor oil is used. Again, I'd like to point out that one of the important things that a person should do when applying the simple remedies is to begin early. Usually within 20 minutes of really understanding that you have the first symptom, that's the most favorable time to apply the simple remedy. May the Lord bless you with these things.